Good afternoon, everyone. We're live today at Sakra World Hospital, Bangalore. We have with us Dr. Amrutesh, who's a consultant medical gastroenterology. Today being 28 July, it is observed worldwide as Hepatitis Day. We will be discussing about aspects around hepatitis. Welcome, sir.
Good afternoon. Yes, I think it's 28th of July will be observed as a World Hepatitis Day. Basically, this is to increase the awareness about the viral hepatitis in the public.
Okay. So let us start with the question again.
Sure.
So what is hepatitis?
See, hepatitis means inflammation of the liver.
Okay.
Again, this can be acute, or if the inflammation lasts for more than 6 months, we label it as chronic hepatitis. The chronic hepatitis has implications like there can be scarring of the liver eventually, and they are also prone for the liver tumors. So cirrhosis and liver cancers are the consequences of chronic hepatitis.
Okay, and what are the causes of hepatitis?
There are so many different etiologies for this hepatitis. For example, alcohol can cause hepatitis. Drugs like acetaminophen or certain TB medications, herbal medications, untested native medications can all lead to drug-induced liver injury. And viral hepatitis like hepatitis A, B, C, D and E, these are the different viruses which specifically affect the liver. They are called as hepatotropic viruses. These can cause acute to chronic hepatitis, and certain other rare diseases like autoimmune hepatitis or deposition of copper in the liver called as Wilson's disease all can lead to acute hepatitis, as well as they can cause chronic hepatitis as well.
What are the symptoms?
Many people can be asymptomatic. Among the symptoms, the common ones are fever, some body ache, headache can be there, joint pain, there can be dark urine, yellowish discoloration of the eyes. Eyes can become yellowish. This is one of the clear-cut sign that somebody is having jaundice.
Okay.
And they can have diarrhea, skin rashes, or even generalized itching of the body can be manifestation of hepatitis. Sometimes they can also cause problems with the other organs like decreased urine output due to kidney involvement, or there can be inflammation with the cardiac muscles causing various irregular heartbeats.
Okay.
And nerves can get involved, and those patients can have low power in their limbs, as well as vision disturbances can be there. Sometimes these viruses will decrease the platelet count in the body, and they may present as bleeding manifestations.
There are different types of hepatitis A, B, C, D and E. What are the differences between these?
One is the virus structures. Except for the hepatitis B, which is a DNA structure, all other are RNA structures.
Okay.
The most important for the public to understand is they should know how this virus spreads from person to person. See, hepatitis A and E spreads through fecal oral route, means like an infected person after using the washroom or fecal after passing the motion, if he is not washing the hand properly and serving the food or preparing the food with the same hands, can spread the infection to the other person. Whereas hepatitis B and C spreads through sharing of the blood and body secretions, sexual route. Transmission from mother to child is very common, and they can all, tattooings, or sharing of the syringes like drug abusers. They can spread infection from one person to another.
Okay, and what are the treatment methods?
See, hepatitis A and E, which causes viral hepatitis, is a transitory disease. The jaundice may last from 2 weeks to 2 months. And here the treatment is mainly symptomatic, and also we should give importance to their hydration part and avoid all hepatotoxic medications in them. We should not use any unnecessary medications in these patients. However, what happens here, the patients will be searching for the magic remedy. They cannot wait for 2 weeks to 2 months to for jaundice to settle down. In this meantime, they will try various medications, including the traditional healers or native medicines and all, and they will end up with drug-induced liver injury, or even multi-organ disorders can happen because of these untested medications. In hepatitis B and C, only select group of acute hepatitis and acute hepatitis C, we use antiviral medications.
Okay.
And similarly in chronic hepatitis B and chronic hepatitis C, in select group of patients only we use the antivirals in them. Like there are certain medications like tenofovir and entecavir, which will help to control the hepatitis B, and certain medicines like sofosbuvir, velpatasvir, daclofenavir. These are the medications which can cure hepatitis C. One is treating this hepatitis acute as well as chronic hepatitis. Apart from this, the most important aspect here is to screen them for liver tumors, especially chronic hepatitis B and C patients who have already developed cirrhosis of the liver, means scarring of the liver. They are prone for the liver tumors.
Okay.
We should screen for the liver tumors every 4 to 8 months once, or in general 6 months once. with ultrasound scan of the liver and as well as blood test called as alpha fetoprotein. The whole idea is to pick up the liver tumors in the very early stage and start the treatment with curative intent.
So this is how it is diagnosed?
So diagnosis is by different tests. Like suppose if you are suspecting a viral hepatitis A, we ask for IgM antibody against this virus, like hepatitis A and E. We ask for IgM antibodies.
Okay.
To detect the hepatitis B, we ask for hepatitis B surface antigen in the blood. To detect hepatitis C, we ask for antibodies against this virus or HCV RNA level in the blood. So depending on the etiology, we have different set of investigations to diagnose what exactly the cause for this hepatitis in this particular person.
Okay. And how does COVID affect hepatitis? Because we are during the pandemic, I'm asking you this question.
It's a very relevant question in this present scenario. COVID-19 and this hepatitis B and C have a kind of complex relation. See, any patient who is having medical comorbidities or will be having tough course if they get COVID-19. Similarly, if they are having hepatitis B and C, their course may be tough if they get COVID-19 infection. COVID-19 also can flare up the hepatitis B and C infections.
Okay.
There are case reports where COVID-19 patients have ended up with acute liver failure because of flare up of the hepatitis B infection in them.
Oh my God.
Second thing is the drugs which are used during the treatment of COVID-19, for example, corticosteroids or tocilizumab. These are the medications which are used during the cytokine storm. Means this is the course during the COVID-19 infection. In severe cases, we use that. These medications can flare up the hepatitis B and C if already that person is carrying these viruses. So we should be careful in using these medications in them.
Can a person affected from hepatitis take COVID vaccine?
Yes, there is no contraindication. All the approved COVID vaccines can be given to the hepatitis B and C patients. In fact, they should be prioritized to get these vaccinations.
Absolutely, when I was thinking the same. Can you highlight or give us more insight on World Hepatitis Day?
See, basically the global burden of hepatitis B means nearly 350 million people are suffering from hepatitis B and 11 lakhs per annum, means 11 lakhs per year people are dying because of hepatitis B and C infections. Even in India, 40 million cases of hepatitis B are there and 6 to 12 million people are suffering from hepatitis C. Such is the burden of the disease in India. And even during COVID-19 pandemic, the same trend is continuing. There is no decrease in the trend as of now. So to increase the awareness about this hepatitis B and C in the public, this year's theme in the World Hepatitis Day is called as Hepatitis Cannot Wait. Means we cannot wait in testing the patients for the hepatitis B and C, and we should not, hepatitis B testing should be done in the pregnant women and vaccination to be initiated in the neonates.
Okay, yes.
At the birth, okay. So, and also public measures needs to be taken in, like, improving the sanitation and providing good water to everybody.
Okay. With this, we come to the end of today's session. If you have any questions, you can leave it in the comment section. Our experts will revert back.